Hi everyone, this is Dr. Jennifer Hobson from the Hobson Institute. This video will review breathing exercises that will address respiratory conditions. The reason I've been putting this together is to address the current COVID pandemic. This is not the first time it's been around. There was a family strain back in 2003 and 2004. There was even research back then that was published in 2005 that showed how nitric oxide, how it could inhibit the replication of coronavirus. But then it was SARS. COVID-19 is also a coronavirus and stands for coronavirus disease 19. These are the things that we're going to go over in this video. 1, what you can do when your breathing gets labored. 2, how can you breathe to take more oxygen uptake in the blood? So if you do have issues with your lungs, what is the best way to optimize ventilation? If your lungs are compromised, if you have a pre-existing condition, what is the best way to get alveolar ventilation? 3, another aspect we'll be reviewing is measuring our breath hold time. 4 is practicing exercises that you can do at home. I've used these techniques for many years with patients that have asthma, COPD, sarcoidosis, anxiety, panic disorders, snoring, and sleep apnea, and different lung issues. First thing I'd like to say to you is that in order to get an idea of your respiratory function, we need to take your breath hold time at rest, which provides us with a good indication. If you have an issue with your lungs, your breath hold time is reduced. The length of time that you hold your breath for will not be as high as it should be. So when the symptoms of COVID-19, one of the biggest symptoms is breathlessness. And since 1975, researchers have known that using breath hold time, you can measure the degree of breathlessness. There's a feedback from your brain to your lungs, but there's also back to the brain. So if your lungs are under bronchial constriction, or if your breathing is non-optimal, it will reflect in a reduced breath hold time. You want to keep an eye on this number. The most important breath hold time you want to measure is the first thing in the morning. So sit up in your bed and allow your breathing to recover and measure this breath hold time. If your breathing is labored, your breath hold time will reduce. And not an optimal breath hold time is 40 seconds. Does everyone have that? No. Functional breathing is when your breath hold time is above 25 seconds. Suboptimal breath hold time is when you breathe and your breath hold time is less than 25 seconds. So in order to measure your breath hold time, it is not the maximum time you can possibly hold your breath the longest. It is a time of breath you can hold comfortably or until that first initial distinct desire to breathe. It's normally an involuntary movement of your breathing muscles. So to measure your breath hold time, or if you've read the book Close Your Mouth, The Controlled Pause from Buteyko, or the BOLT score from the Oxygen Advantage, those are both written by my mentor, Dr. Patrick McKnone, you will need a watch with a second hand or timer. You would need to take a normal breath in through your nose and a normal breath out through your nose. You hold your nose and you time what it takes the seconds until you need to breathe, that first distinct desire to breathe. Corresponding with that, you may feel that there is an involuntary contraction of the diaphragm or some tension in your throat, or you feel a distinct desire to breathe. So your breath hold time, keep an eye on it in the next few coming days, weeks, and months ahead as we go through the coronavirus pandemic. If you do have signs of breathlessness, it is important that you don't breathe fast or shallow. This is ironic because when you feel breathless, whether you have a pre-existing condition, it is very common with people with asthma and those with respiratory conditions. It is very normal that when you feel breathless, You feel that you are not getting enough air into your lungs. There's a level of air hunger, and what that will generate is automatically people start breathing faster, they start breathing shallow, and often they breathe through their mouth. And that will only feed back to their symptoms. That is entirely the wrong thing to do when you have breathlessness. Anytime you feel breathless, even if you're wheezing, if you have coughing with asthma, if you have respiratory complaints, the optimal way to enhance alveolar ventilation, in other words, the amount of oxygen that is reaching down into the small air sacs in your lungs, because ultimately we breathe that oxygen in, is taken into your body, so oxygen can transfer from the lungs to the blood. And with COVID-19, one of the recognitions is that when there is a severity or progression of the disease, the blood oxygen saturation decreases. Now, there's a way to breathe to enhance blood oxygen saturation. It is not by breathing fast and shallow, but by breathing slow and deep, in and out through your nose. So the best way to think about breathing is that it should be light, it should be slow, and it should be deep. Some of you will remember this better with the acronym LSD. So you are thinking about light, and you're thinking about slow, and you're thinking about deep. What I'd like you to practice is put your hands on either side of your lungs at the lower two back ribs. So you're going to put your hands right at your lower back ribs. There you can feel the base of your lungs, where it meets your abdomen, where the diaphragm separates your midsection. The diaphragm is a massive muscle that in many people isn't very active. So we want to try to activate it. You're going to have your lips together, your tongue on the roof of your mouth. Breathe in and out of your nose and decrease the speed of air in and out of your nose. Reduce the air coming in and out of your nose. So you're going to be holding your lower ribs, feeling that movement, and starting to reduce the airflow through your nose. As you breathe in and out, perform a long, prolonged exhalation. As you breathe in, you should feel that your lower ribs are moving inwards. So gently breathe in through your nose. Feel the lower ribs are moving outward. And gently breathe out. And you feel the lower ribs moving inwards. This is a good time to do it. So try this with me. An optimal rate is 6 breaths per minute. You can time it. So I want you to breathe in, 2, 3, 4, out, 3, 4, 5, 6. Breathe in, 2, 3, 4, out, 3, 4, 5, 6. Breathe in, 2, 3, 4, out, 3, 4, 5, 6. In, 2, 3, 4, out, 3, 4, 5, 6. Breathe in, 2, 3, 4, out, 3, 4, 5, 6. In, 2, 3, 4, out, 3, 4, 5, 6. In, 2, 3, 4, out, 2, 3, 4, 5, 6. And if you can continue like that for a period of time, start with 5 minutes. You want to be able to reduce your breathing to 6 breaths per minute. So you're going to breathe in for 4 seconds and breathe out for the count of 6 seconds. But during rest, you shouldn't hear breathing. You shouldn't see it move in your body. When we think about breath, we think of 3 pillars: the biochemistry, biomechanical, and cadence breathing. Each pillar is the leg of a stool that has its own merits. When changing your breathing pattern, it is important that you don't increase the minute ventilation. Don't breathe harder than you feel you need to breathe. The harder you breathe can lead to bronchial constriction. We often see it with people with asthma. They feel that they have their airways getting tight, that they're not getting enough air, and that they have to start breathing harder to compensate for that feeling that they're being suffocated. This actually causes the airways to cool and to dry out, and it feeds back into airway narrowing. So when you think about breathing, think about not to breathe more than you feel that you need to, but of course, when you're feeling respiratory symptoms, your breathing is naturally faster and harder. But don't exaggerate that. The harder you breathe causes bronchial constriction. If you have respiratory symptoms, your breathing is naturally faster, but don't exaggerate it. When you feel breathless during breathing, a good way to reduce the feeling of breathlessness is to breathe light, to breathe slow, and to breathe deep. So the sensation of breathlessness is reduced and alveolar ventilation is increased when you reduce your respiratory rate, how fast you're breathing. So when you're thinking about breathing, and it's not just the amount of breaths per minute, but about the size of each breath, which is called the tidal volume. And the number of breaths per minute multiplied by the tidal volume is the amount of air you breathe in and out per minute. I often feel that patients with asthma, they often feel that their airway is getting tight. They're feeling that they're not getting enough air. They breathe harder to get rid of that feeling of suffocation. But remember, this causes the airway to narrow. You don't want to be breathing more than you need to, which will cause the bronchioles to constrict. The second pillar is using your diaphragm. Many people will talk about the benefits of deep breathing, but they often misinterpret this. When I tell people to take a deep breath in, they take a big breath in, and that's not correct. Taking a deep breath is not a big breath. A deep breath manifests a lateral expansion and contraction of the lower ribs, that's your diaphragm. So as you breathe in the lower ribs, you should move out as you inhale and breathe in as you exhale. So why do we slow down our respiratory rate? The reason being is for every breath you take into your body, not all the air reaches the small air sacs in the lungs for gas exchange to take place and to bring it to the lungs, to the blood. For every breath you take, 150 mils of that air remains in dead space. A certain amount of air remains in your nose, a certain amount remains in your throat, in your trachea, in your bronchi, and in your bronchioles. Dead space, if you are breathing fast and shallow, you are taking a lot more breaths per minute, and you're leaving a lot more in that dead space. When you reduce respiratory rate, you're not wasting so much air in the dead space. The key with breathing is to enhance alveolar efficiency. Breathe slow, breathe light, and breathe deep. Now, when you are feeling breathlessness, it is difficult to reduce the breathing. Reason being is that your breathing is already labored, and there is a feeling of suffocation or air hunger. But a way to help your breathing and to get it under control is to help calm your breathing, is to take small breath holds, little small breath holds as you breathe. Whenever you have symptoms, whether it's wheezing, coughing, breathlessness, a good way to control breathing is to do small breath holds. And it goes as follows. You're going to take a normal breath in through your nose and a normal breath out of your nose. You're going to pinch your nose and you're going to hold your nose. 5, 4, 3, 2, 1. Let it go. Breathe in and out of your nose now for 10 normal breathing seconds. Again, a normal breath is, you're going to take a normal breath in through your nose And a normal breath out through your nose. You're going to pinch your nose. 5, 4, 3, 2, 1. Breathe. And breathe in and out of your nose now for 10 seconds. So these are little breath holds. We're going to try this again. I want you to gently take a normal breath in through your nose and a normal breath out of your nose. You're going to pinch your nose. You're going to hold your nose. 5, 4, 3, 2, 1. Let go and breathe in normal for 10 seconds. These are little breath holds. We're going to continue doing this a little while. And again, breathe in normal breath through your nose and a normal breath out of your nose. You're going to pinch your nose, hold your nose. 5, 4, 3, 2, 1. Let go and breathe in and out normal for 10 seconds. And again, take a normal breath in through your nose and a normal breath out through your nose. Pinch your nose, hold your nose. 5, 4, 3, 2, 1. Then let it go and breathe in and out of your nose for 10 seconds. It's important that the length of breath hold time doesn't affect your or disrupt your breathing. So if you feel like 5 seconds is too long and it makes you breathe big when you unplug your nose, that's too long of a breath hold. A rule of thumb is that your length of breath hold time shouldn't be more than your CP measurement or the Bolt measurement or the measurement of your breath hold time in the beginning of the webinar. If the length of your breath hold time is 6 seconds, the length of your time to hold your breath should be only 3 seconds. So everybody, let's take one breath hold. Just see how long you can hold your breath till that you feel that distinct air contraction of your throat, your neck, or your tummy. Just that distinct first desire to breathe. Gently breathe in, gently breathe out. Plug your nose and time yourself. You're going to time yourself and hold your breath until you feel that neck jerk or tummy jerk. That number you need to know. You're holding your breath, and ideally above 25 is functional, below 25 is not. The goal is 40. So with that breath hold time, you understand if you need to work more on your breathing. So when your breathing is labored, it's important to breathe, not breathe fast and not breathe shallow, not breathe through the mouth. That will only feed back into your symptoms. So again, for the breathing emergency exercise, for coughing, for wheezing, for labored breathing, you're going to do this. You're going to breathe in through your nose normally, a gentle breath out through your nose. You're going to pinch your nose. You're going to hold your nose. 5, 4, 3, 2, 1. Then you're going to unplug and breathe through your nose for 10 seconds. If you're feeling anxious, 2 things to do. It's just simply slow down the breath. Don't breathe fast and shallow because it'll contribute to agitation of your mind. There's a link to your diaphragm and the emotions, and a link between how fast you breathe and your emotions. Fast and shallow breathing triggers fight or flight, the sympathetic nervous system. It's a stress response. Unfortunately, we are in that system and we're not fighting and we're not flying and we're not running, but we're sitting there breathing improperly. If you're feeling a stress response, you need to do the opposite. And don't take that big, deep breath that people normally tell you to do. If you take big, deep breaths, you will be blowing off too much carbon dioxide, which will cause your blood vessels to constrict and will cause a left shift of the oxygen hemoglobin dissociation curve. But ultimately, the more air you breathe, the less oxygen gets delivered throughout the body. Don't have the belief that the more air you breathe through your lungs, the better. If you breathe hard, you will feel lightheaded. That is not a sign of increased oxygen delivery to the brain. What happens there is that the hard breathing has taken out too much carbon dioxide from the blood through the lungs, and the loss of carbon dioxide reduces oxygen to the brain. When we did the small breath hold exercise we just did, where you breathe in and out, you hold your breath for 3 to 5 seconds, and then you breathe normally for 10 seconds, you're harnessing nitric oxide in the nasal cavity. Nitric oxide is produced in the nasal cavity. It is produced in the nose, and it also produced in the paranasal sinuses. But nitric oxide has antiviral effects. It is antibacterial, and it is antimicrobial. It is not produced in the lungs to the same quantity, and it's produced in the nose and not the mouth. The only way to harness the antibacterial properties of breathing is if you use your nose. If you breathe through your nose, 50 to 200 parts per billion by nasal breathing is made of nitric oxide. You can also enhance this by 3,000 parts by humming. If you look at the research done by Professor John Lundsberg at the Carl Links Institute in Sweden, he talks about humming increasing the production of nitric oxide. Getting nitric oxide in our paranasal cavity into the nasal cavity is produced by humming more, getting more of it. You are taking a normal breath in through your nose and you hum. So try this. You're going to breathe in through your nose, put your tongue in the roof of your mouth. Now hum. Nitric oxide is created in the nasal cavity by humming. You need to carry that into your lungs. So nitric oxide sterilizes the air. It also just redistributes the blood throughout the lungs, and it increases oxygen uptake in the blood by 10 to 15%. Therefore, nitric oxide is the body's first line of defense to viruses. Now, despite this, world organizations are not talking about the importance of nose breathing. And when I am talking about nose breathing, I'm talking about nose breathing during rest, nose breathing during physical exercise, and nose breathing during sleep. So people that are not infected, it is vitally important to do 2 to 3 things. 1, make sure you're breathing in and out of your nose at all times. 2, in the presence of someone coughing or sneezing, hold your breath. Don't breathe and let that air enter into your lungs. When people are sneezing, coughing, or even breathing, if they are infected, they are exhaling water particles into the air, just like aerosol cans spraying, which can travel 1.5 to 2 meters through the air. If you are in the proximity and you're inhaling this water particle into your body, when you inhale these particles into your body, the virus can replicate. The person that is not infected should make a concerted effort to breathe through their nose, hold their breath if they are in the presence of people in public, and also to breathe as light as possible. So whenever I'm traveling, I try to breathe through my nose and breathe in hardly any air, as least as possible through my nose. This is going to do 2 things. You're going to take you're going to take much less airborne air into your lungs, and the slower you breathe, the higher concentration of nitric oxide in your nose. If you're really slowing down your breathing, and when I say slow down your breathing, I'm talking about slowing down your breathing to the point where there is hardly any air coming into your lungs. So you're taking a really soft and slow, gentle breath through your nose, and then you're having a relaxed, slow, and gentle breath out of your nose. You should breathe almost to the point where you hardly breathe any air. Now, of course, you're breathing, and at the same time you're breathing, take that air into the lower portions of your lungs. The greatest concentration of blood in the human lungs is in the lower lobes, not the upper regions of the lungs. Now, mouth breathers are going to be breathing more air in. The tube in your throat is a lot bigger than the nasal passages in your nose, so the volume is bigger. They have no defense, and they're ventilating the upper regions of their lungs, which in turn is actually reducing the oxygen intake in their blood. Mouth breathers also get rid of too much carbon dioxide. Carbon dioxide is not just a waste gas. The release of oxygen from the red blood cells to the cells is dependent on the presence of carbon dioxide. Your blood circulation is dependent on the pressure of CO2 in the blood, and it should be about 40 millimeters of mercury. I use a capnometer in the clinic to test patients that have respiratory distress, and many people are very low in CO2. People that have cold hands, it's an indication that they have poor breathing habits or patterns. The hands should not be cold. The circulation in the hands should be good enough to have warmth in the hands. So when you're out in public, remember that it's important to feel air hunger. Deliberately reduce the amount of air going into your body. This is when you're around people. Slow down your breathing to harness greater concentration of nitric oxide in your nasal cavity, and then carry it into your lungs by breathing through your nose. Remember, nitric oxide is a natural bronchial dilator. It sterilizes the air and plays a role with the production of surfactant. And surfactant in the lungs is very important to maintain elasticity and movement in the lungs. COVID-19 impacts the production of surfactant. That is known. Nitric oxide improves the production of surfactant. If you look at some of the new patents and trials in the US, some of these trials are investigating the benefits of inhaled nitric oxide as a treatment for COVID-19. Your nose already produces this gas. The key is to harness it. It is not just good enough for non-infected people to breathe through their nose. We also need the infected people to breathe through their nose. This is why. When you breathe in and out of your nose picks up moisture and heat, and you're taking that warmth and moist air into the lungs. But on the exhalation, your nose traps that heat and moisture through the exhaled breath. So nose breathers emit less moisture into the atmosphere than mouth breathers. If an individual is breathing in and out of their mouth, they're emitting a lot of water vapor and a lot of water particles out of their mouth. There is 42% greater water loss breathing out of your mouth than using your nose. Your nose traps that moisture. So if you're an individual, if any of you feel that you have had symptoms and that you're in the presence of other people that have had symptoms, reduce your breathing and keep your mouth closed. Don't emit so many water particles in the air, because those water particles are a means of transmission of the virus. So to give you a few pointers, you need to make sure that your mouth is closed during sleep. You need to protect your airways. You should never wake up with a dry mouth or dry throat in the morning. You should always wake up with a moist mouth in the morning. Long-term nasal breathing during sleep is super important for health and energy. Mouth breathing causes unrefreshed sleep, lighter sleep. It also increases the risk of snoring and the risk of obstructed sleep apnea. We have encouraged people to tape their lips so that they breathe exclusively through their nose to sleep. I know that sounds a little bit crazy, but we've traditionally used 3M micropore tape. And the micropore tape, you cut the mouth size I always put it in the back of my hand and then put it over my lips. And I keep my mouth closed at night. I always place my tongue in the roof of my mouth. Not only that, we definitely use either Breathe Right, these Breathe Rights, or this is called the mute. These are nasal dilators to open up your nose. This is called the nasal aid. You want to open up your nose and then possibly tape, but there's more options for the tape. Another good tape I've been using for years is Somnifix, which covers the lips. It has a little vent right in the middle to allow breathing through your mouth. If you need to, you know, some people can't tolerate keeping their lips together. Now, on the market by my mentor, Patrick McNone, is a new tape called Myotape. And Myotape is from Ireland. It has a hole in it. So this is actually ideal for people that are nervous about taping because it doesn't cover the mouth. And you're basically just putting about 30% a stretch. You put it over the mouth and it kind of shrinks your lips a little bit together and keeps them together. Just like that. And they also have them for kids. So I just tried these with my kids this week and they love them. So they're just a little smaller. So that's myotape.com. So I've given you three options. Three options. The 3M micropore tape we've been using for years. That you can get in a pharmacy. The Somnifix is somnifix.com. That has a little vent, and then the Myotape has the hole. Now I'm just going to close by doing a few slow breathing exercises so that we can practice more. This is not just beneficial to do when you have symptoms of breathlessness. Remember that when you have symptoms of breathlessness, it's difficult to actually slow down your breathing. So when you have symptoms of breathlessness, you can try this exercise or simply try the little small breath holds that we tried in the beginning of the presentation. Or you can also do walking with small breath holds during walking. So when you are having symptoms, and when I'm talking about symptoms, I'm talking about wheezing or coughing or breathlessness, a good way to get your breathing under control is to do the simple breath holds for 3 to 5 seconds every 10 seconds of breathing. So, and you just have to make sure you're using your nose to breathe. So in other words, you're going to take a normal breath in through your nose and a normal breath out through your nose. You're going to pinch your nose. You're going to hold your nose for 3 to 5 seconds. Then you're going to let go and breathe in through your nose. You need to carry that nitric oxide that gets built up in your nose into your lungs. You need to harness that nitric oxide sterilization aspect as it comes into the airways. After you hold your breath for 3 to 5 seconds, you breathe in normally for 10 seconds, and then you repeat. If you're having symptoms, of course, this is not a replacement for medical help. Please get your medical help. What I would say to you is practice this exercise for 10 minutes each hour. And I know that sounds like a lot, but when people come in to see me for COPD and severe asthma and high anxiety, I have them practice these small little breath holds because I want to get them to the point where then I can actually get them to slow down their breathing. So that's one exercise. Normally people that have high anxiety or severe breathing, they can't slow down their breath. So you need to do those little breath holds, the 3 to 5 second breath holds for every 10 seconds of breathing. Now the second exercise, you're going to take a normal breath in through your nose, a normal breath out through your nose. You're going to pinch your nose. You're going to hold your breath between 5 to 10 paces when you walk. When you need to breathe, breathe through your nose. You should not do this if you're pregnant or if you have heart conditions that are unstable. This is a very good exercise to do. So this is when you're walking. So you're going to, again, take a normal breath in through your nose and a normal breath out through your nose. You pinch your nose you're walking, you hold your breath 5 to 10 paces when you're walking. When you need to breathe, you breathe through your nose. This exercise will harness nitric oxide, and it will also slightly increase carbon dioxide in the blood, and it will have a bronchodilation of the airways, and it will reduce the sensation and perception of breathlessness. The very feeling when we are experiencing breathlessness is that we want to breathe more, right? That's what we feel like, oh, I'm not getting enough air. We want to breathe faster and shallow. It's absolutely the wrong thing to do. The recommendations that are coming from China as a part of post-treatment of COVID-19, they're saying to monitor your oxygen saturation, monitor your blood oxygen saturation. You can buy the small little pulse ox that you can put on your finger from Amazon. They're very inexpensive, anywhere from $30 to $100. You put them on your finger. It has a little red light and a little infrared light, and it tells you how fully loaded your blood is with oxygen. To increase alveolar ventilation and to increase oxygen uptake in the blood, this is a repeat of the exercise earlier on. I want you to have your hands on either side of your lower ribs. Have your mouth closed, your tongue on the roof of your mouth, and only breathe through your nose, and start slowly slowing down your speed of air coming in through your nose. And at the top of the end of the breath, you have a relaxed, slow, gentle breath out. The whole objective is that in terms of slowing down your breath, you want to breathe slowly, and you want to deliver that air down to the deeper regions of your lungs. If you breathe slow, you are not wasting as much air in dead space. If you breathe fast and shallow and through your mouth, you are not ventilating your lungs as optimally as you should. That exercise too can be very helpful. Even if you are not having symptoms, it can be very helpful in terms of normalizing your breathing patterns. Remember, you breathe light, you breathe slow, and you breathe deep. So you are really slowing down your breath, and at the top of the breath, you're having a relaxed, gentle breath out. Now, of course, this exercise is a lot easier to do when you don't have symptoms. So you're just put your hands on either side of your rib cage, the lower ribs. You're gently breathing in 30% less air. You're pausing at the top, and you're exhaling slower and gently, and almost even less air coming out. If you're feeling breathlessness, remember that I said from the very start, your breath hold time from the beginning of the talk will provide you a good indicator of the functioning of your lungs. So if you have bronchial constriction or issues with your lungs, it'll manifest with a lower breath hold time. If you're noticing that your breath hold time is reducing, it's really time to do breathing exercises. If your respiratory rate is 30 breaths per minute, you won't feel like really slowing down your breath. But what I'm saying is that you really should try to do it. You will find that the small breath holds will be easier for you to do as an emergency exercise. I give you 2 small breath hold exercises. You also have slow breathing, so those 3. I'm also talking about the importance of nose breathing during the day, during physical exercise, and sleep. Vitally important. When you talk about breathing, the worst type of breathing is fast, shallow, and through the mouth being open. You have absolutely no protection if you do that. I cannot make a claim that nose breathing is going to protect you from COVID-19. The disease is very new. We're still learning about it. But if you look at the research of nitric oxide, it is plausible to say that whatever chance you have of defending the body from COVID-19, you have absolutely no chance if you're breathing through your mouth. And whatever chance you have is when you're using your nose, both to breathe in and out of your nose. And again, in times when you're faced with individuals that are coughing around you, hold your breath, walk away, reduce your breathing volume. If you can't hold your breath and keep breathing through your nose only, try to just keep breathing through your nose. Even if you feel air hunger doing that, don't worry about it because it's actually good. We deliberately reduce people's breathing to feel air hunger to actually increase their carbon dioxide levels in their blood. When carbon dioxide levels increase, they feel warmer, they feel a little drowsy. It is a good exercise for insomnia, agitation of the mind. By practicing slowing down your breathing volume to increase the carbon dioxide levels in your blood, you know that a carbon dioxide increases if you feel air hunger. So if you're doing it right, you're feeling air hunger. But this can help open your airways, your blood vessels, the 70,000 miles of blood vessels we have in our human body. You can influence the blood vessels not by breathing hard, but breathing light. It is not healthy to breathe hard. There is a belief out there that the more air you bring into your body, the more oxygen delivers to the tissues. It isn't true. If you want to learn more about the physiology of this, look up and learn more about the Bohr effect. Back in 1904, a Danish physiologist by the name of Christian Bohr learned this and discovered it. If you want to go even further, look at the oxygen hemoglobin dissociation curve and look at how the red blood cells release oxygen to the tissues. The red blood cells release oxygen from blood to the tissues in the presence of carbon dioxide, possibly nitric oxide. It increases temperature and through the phosphoglycerate. So if you want to learn more about breathing, I have many online products that you can learn how to breathe with these concepts and videos. Go to the HobsonInstitute.com. Remember, everybody, please try to use your masks as much as you can, especially if you're in public or outside. And if you have problems wearing your mask, use a nasal dilator under the mask. It will help you keep your nose open because the nose tends to plug with the mask. Thank you for your listening and stay safe.